I am Dr. Ravi Shankar, Gastroentrologist working in SL Diagnostics. So today I will discuss a few things about gastroesophageal reflux disease, otherwise called GERD. The GERD is a common problem experienced by a number of people, but the symptoms could be mild. People who have moderate or severe symptoms, they seek medical attention and they present to us and we treat them. So what is the GERD? GERD stands for gastro means stomach, esophago means food pipe, reflux disease means acid or food contents coming up into the esophagus and causing problems. So this is otherwise called GERD or GERD. So what are the symptoms with this GERD? Usually the common symptom is a heartburn. Heartburn means burning in the chest. It's nothing to do with the heart, but it is burning in the chest. Why the burning is there? It is due to the acid of the stomach coming up into the food pipe and causing burning sensation. When this happens, the patients suffer symptoms, and usually this heartburn is postprandial or sometimes nocturnal. And this symptom reduces the quality of life. So the patients seek attention, and this disease also goes on for long term. That means several months, or sometimes it is a lifelong problem also. So apart from the heartburn, there are certain other symptoms like extraesophageal symptoms like chronic cough, asthma-like presentation, pharyngitis, and sometimes dental problems. These could develop in patients who have GERD. So what needs to be done for GERD patients? They require treatment because the symptoms are significant enough and the symptoms reduce the quality of life. So patients with mild symptoms, they need not get the treatments, but patients with significant symptoms always seek medical attention. And when they present to the doctor with GERD symptoms, which I have enumerated, and there could be some investigations that are usually relevant to this disease to confirm the disease and to exclude certain other diseases. So what's a common test that is required for GERD patients is an endoscopy, and some patients require testings like 24-hour pH metry and in certain special cases esophageal manometry. So after the diagnosis is confirmed by these tests, one goes forward with the treatment. If treatment is delayed or treatment is not adequately given, these patients may develop certain complications like peptic esophageal stricture, that means narrowing of the esophagus because of the ulcerations that is produced by the GERD. Some other complications like Barrett's esophagus, and another rare but little complex type of complication is the development of a tumor in the lower third of the esophagus called adenocarcinoma of the esophagus. So GERD in a small number of patients may predispose to malignancy, that is adenocarcinoma of the lower third of esophagus. So the complications say that these patients with GERD need to be treated adequately. So what are the treatments that are available to us? We have a lot of drugs available, and the drug therapy is the commonest mode of treatment for GERD. What are the drugs? The proton pump inhibitors, the H2 receptor antagonists, and the antacids. Usually when the patients have significant symptoms, proton pump inhibitors are used. They need to be used for at least 4 to 8 weeks initially, and then the drugs can be withdrawn if the symptoms are reduced. But it so happens that the patient gets the medication, and once he is off the medication, the symptoms do come back. That means there is a relapse or recurrence of symptoms after the medicine is withdrawn, and this is not uncommon. So some of these patients require long-term treatment or intermittent treatment or on-demand treatment. So as the medication, or that is the PPIs, need to be used for longest duration, people do talk about the adverse effects of this PPI In fact, we can say, and from my experience also I say that these complications are very minimum to non-existent, but in literature there are reported complications of these drugs, that is PPIs, but that is in a very small percentage of patients. Now, are there any other treatments? Because people do talk about the complications of the medications, though they are very few or non-existent or in a very small number of patients, but still we can talk about other treatments, especially people who are wanting other modalities of treatment or who do not want to take the medication. There are certain other modalities of treatment like endoscopic and surgical. Surgical treatment is a standard treatment, that is laparoscopic fundoplication. It is well known, but because of the advent of drugs and in the future probably because the endoscopic treatments could become more popular, there could be less and less need for surgical treatments. But all said and done, the surgical treatment is a well-established treatment of that is the laparoscopic fundoplication is a well-established treatment of GERD. Now, what is there in between the medical treatment and the surgical treatment is the endoscopic treatment. There are a few modalities of endoscopic procedures like Stretta procedure, Arma procedure, Girdles procedure, and a few other device-related techniques that are available. And a few things are not yet available in the country. They could be available in the near future. So thank you so much for hearing about this GERD, and summarizing, it could be said that GERD is a long-term disorder with heartburn as the main manifestation, and it goes on for a longer time. The medication is proton pump inhibitors commonly, and there are certain other treatments like surgical treatment and endoscopic treatments. Thank you so much.